Hello, I am Lartey. I am an adjunct professor of nutrition at the University of Ghana and a former director of nutrition at the Food and Agriculture Organization of the United Nations. Food systems have gained global attention over the past decade. They are very complex. So what exactly do we mean by sustainable food systems and food systems transformation? Let's start by thinking about individual food choices and diet quality. According to the World Health Organization, a healthy diet is adequate in foods for a healthy life, diverse, containing a variety of foods, and low in ultra-processed foods, which are high in sugars, salt, and saturated fats. It should also be safe, not resulting in foodborne illnesses. Improving diet quality requires more than consuming the necessary amounts of energy and essential nutrients. A diet that meets calories needs alone provides only the essential nutrients is not conducive to long-term health and well-being. Many non-nutrient components of food, particularly plants, have been correlated with lower disease risk and improved health. Healthy diet must provide a variety of foods to enhance long-term health and adapt to cultural food preferences. Food environment is the space around which consumers select their foods. Food environments are determined by availability, accessibility, and convenience. Food environment determines the individual diet quality. The choices consumers make from their food environment impact the quality of diet and subsequently their nutritional status. For example, if healthy foods such as fruits and vegetables are not readily available or are not affordable, consumers are not likely to select these foods. Likewise, if the food environment is one where cheap, unhealthy foods high in calories, sugar and salt and fat are readily available, consumers are likely to select these, which would negatively affect consumer diet quality. In the broadest framing, food systems encompass food production, processing, packaging, distribution, retailing, and the consumption of food. What happens at the food systems level impacts the food environment and subsequently the food available to consumers. Food systems determine the types of food produced and the processes that they go through until food finally lands on our table. Food systems also influence the health of people and the planet. First, because of the availability and consumption of cheap, highly processed, nutrient-poor foods, many populations are going through the triple burden of malnutrition, that is undernutrition, micronutrient deficiencies, overweight, and obesity. Poor diet has become the leading risk factor for disease and death among adults. Secondly, food systems account for up to 34% of the greenhouse gas emissions driving climate change and contribute to 78% of the pollution of water bodies. Our planet is said to be facing the triple planetary crisis of climate change, biodiversity loss, and pollution. Third, our food systems are fraught with inequity. For example, although the world produces enough food to feed everyone, we still have over 700 million people going to bed hungry. Globally, 3 billion people cannot afford the cheapest form of a healthy diet, let alone a diverse, healthy diet. Smallholder farmers who produce most of the nutritious crops live in poverty. Women employed in agri-food systems earn less than men in similar jobs. and women often have less access to land, credits, extension services, and technology. Fourth, there are huge power imbalances within the food systems. For example, there are 1.5 billion food producers, of which 70% are small-scale farmers, and there are 7.5 billion consumers. In between these are a very small number of companies that control the food systems. Only the top 10 companies control 90% of agricultural commodity trading. With food and beverage processors, only the top 10 companies control 90% of food processing. The concern here is that this places the control of the entire food systems in the hands of a few companies, while most food producers and the 7.5 billion consumers have little influence. Fifth, food systems are not resilient. A resilient food system can withstand and recover from disruptions and shocks. COVID-19 exposed the fragility of our food systems. Pandemic containment measures resulted in food supply chain disruptions and dramatic increases in the number of food insecure people. At the nexus of these challenges is what people eat, how food is produced, and the imbalances of power in current food systems. It is clear there are many issues with our food systems that we need to address to ensure human and planetary health. Planetary health is defined as the health of human civilization and the state of the natural systems on which it depends. This concept recognizes that human health and the health of our planet are intricately connected, and that ensuring healthy diets for all through sustainable food systems is essential for the well-being of people globally and for safeguarding our planet. So, what do we mean by healthy diets from sustainable food systems? According to the Food and Agriculture Organization of the United Nations, a sustainable food system is one that delivers food security and nutrition for all without compromising the future generations' economic, social, and environmental base. A global shift from rural or traditional food systems towards modern or industrialized food systems creates more reliance on processed foods and increases dietary risk factors through consumption of diets high in salt and red meat, but low in fruits and vegetables, whole grains, and legumes. Also, the ecological footprint of food consumption or its environmental impact tends to be higher in countries with industrialized food systems compared with countries with rural traditional food systems, despite the greater efficiency of production in industrialized systems. This is largely driven by increasing demand for animal source foods due to dietary shifts. So, what is the food systems transformation we want? In September 2021, the United Nations Secretary General called for a food systems summit. This summit called for a transformation to make food systems achieve the following: deliver safe and nutritious diet, ensure equity for all, especially vulnerable groups like smallholder farmers, be environmentally sustainable, and be resilient to withstand shocks and other crises. The challenge is to make the necessary changes to address these objectives. To truly achieve food systems transformation for human and planetary health, all parts of the food systems must work together under coherent policies. For example, agricultural policies should align with food-based dietary guideline policies, national procurement policies, and school feeding policies. A strong political will and commitment are essential. We need to build local capacity to shepherd the food systems transformation process. The scientific and research community has a role to play in generating evidence on what works and at what cost. And the transformation pathways must be context-specific and culturally relevant. There is no one-size-fits-all approach. The global momentum for such action is increasing, but the evidence base needed to galvanize government and hold stakeholders accountable is lacking. More direct and proactive inputs are urgently needed to strengthen the evidence base connecting food systems, diet, environment, and nutrition. Strengthened participation will require innovations in metrics and methodologies combined with new thinking on what constitutes viable evidence and a greater willingness to engage with policymakers and private sector agri-food sectors. We are standing at the crossroads to decide for better or worse for our food systems. Business as usual will be catastrophic for human health and planetary health. Following the path of transformative action now will put our food systems on a path of sustainability.